This is a cell. A lot of cell will make up a tissue. The tissue grow bigger and bigger. So what is the maximum size the tissue can reach? Let's think this square is the spatial boundaries that the tissue can grow to the biggest size, but is still within this square and under control. However, if there are masses of tissue exceeding the boundaries and uncoordinated with the tissue, those abnormal masses are called tumors. Normally, benign tumors mean they will stay within one site of the body and can be easily removed by surgery. However, if there is any abnormal mass that still persists after the surgery and has the ability to grow from one site to different sites and evoke changes in the body, it is called cancer, means the tumors that can run. Cancer is tumor. But tumor may not be cancer. Cancer becomes almost incurable once they metastasize because cancer isn't just one disease, it is a huge collection of diseases. And we don't have a magic tiny net to cure them all. The current treatment of cancer is often a combination of surgery, chemotherapy and radiation. The purpose of chemotherapy and radiation is to kill cells that are newly replicating. However, even in rapidly growing tumors, the fraction of cells replicating is just 20% at all the time. Besides, there are tons of cells in the body also constantly replicating daily, weekly, such as hairs, skins, nails. Therefore, the treatment of killing indiscriminate replicative cells may not be the most effective and also result lots of complications. Nowadays, immunotherapy is a promising treatment of cancer. The idea is to boost and specifically correct the immune system to fight cancer. Generally, tumors arise through mutations and at the same time create foreign antigens which are enemies of antibody or the immune system. The immune system is capable of recognizing antigens, targeting them for destruction, and sending T-cell signaling to eliminate tumor cells. However, cancers understand the development and function of immune responses, so they can evolve and adapt. They effectively switch on protective shields to hide from the immune system and against whatever is attacking them by changing their gene expression. They disrupt T-cell signaling. They invade the local immune system. They induce tolerance which sends signals to stop immune system functioning. So, what is the solution of immunotherapy? 1. Stimulating non-specific immune. Researchers can do this by injecting small cell signaling such as interferon alpha and interleukin-2 T-cell growth factor that bind alert immune cells such as these T-cells. T-cells are the main players in the fight against cancer. When activated, they can attack and kill tumor cells. 2. Blocking immune checkpoint inhibitors. Immune checkpoint molecules are usually PD4 and PD1 which stop the immune response to prevent collateral damage to healthy tissues. But to fight cancer, scientists need to remove these blockades to make the immune response stronger and accelerate them to recognize and further kill tumor cells. 3. Adoptive cell transfer. Scientists extract the immune cells from the patient and activating them outside the body. The approach is to take immune cells directly from the tumor. It is difficult to extract enough cells. But the advantage is that the cells have already learned to recognize the tumor, so will enhance the immune response when the cells are reintroduced to the patient. 4. Vaccine. These vaccines are weakened bacteria used to direct immune cells very specifically to the cancer tissues. For example, a weakened version of the herpes simplex virus modified to produce an immune-stimulating factor is being developed for melanoma and head neck cancer. One of billions signs of immune response is the inflammation like swelling, hot, redness. Therefore, patients should expect that when using immunotherapy, cancer could get worse before it gets better, and the treatment should be continued to its full benefit. The cancer may or may not go away, but can be controlled for a period of time. Right now, it is difficult to predict who might respond to a particular treatment or better with the combination of treatment. Immunotherapies are still experimental. The last few years have seen promising. However, different patients respond differently to immunotherapy remains a clinical challenge. Besides, scientists need to find a better way to judge the success of different anti-cancer treatments, or immunotherapies in particular, and to work out the best dose that is used in patients. There are still much work to do to help get drugs from the bench, through clinical trials, and to the patients.